12 tips that will help you stay alive. In a dangerous situation, the first thing that comes to mind is the advice of our relatives and friends. But sometimes even the most popular advice turns out to be wrong and harmful. Did you know that putting ice on a bruise is not the best idea, and that you should not lift a person who has lost consciousness? Today you'll hear 12 of the most famous myths about survival and what to do in an emergency. Number 12. Removing a foreign object from your eye. First of all, if you also have a focal object in your eye, such as a piece of glass, don't do anything yourself. Ask someone to take you to the hospital. If it's just an eyelash caught in your eye, be sure to wash your hands before you do anything. Go to the mirror and try to see the lashes. Then help to get the tears to release the foreign object. Once the lashes are in the corner of your eye, take a damp piece of cloth and remove it. Number 11. Applying an ointment to the wound. Ointments contain unwanted moisture, which becomes an excellent breeding ground for bacteria. Therefore, it is better to wash the wound with cool water and soap and apply a dry dressing. You'll see, the wound will heal much faster. Number 10. Rubbing a person with fever and alcohol or vinegar. Vinegar and alcohol are good in the blood. So rubbing with them is like getting drunk or soaking yourself in salad dressing. But seriously, rubbing alcohol can cause intoxication. And vinegar greatly increases the acidity, which is especially dangerous for children. So do not believe any outdated advice. Instead, the patient should drink plenty of water, tea, and other non-alcoholic beverages. Cool the air in the room to a temperature of 16 to 18 degrees Celsius. In such conditions, the body itself will be able to overcome the chills. If the condition does not improve, you should consult a doctor. Number 9. Provide aid in case of unconsciousness. If someone has fainted, they should be put in an upright position and splash cold water on their face, right? That's the advice most of us follow in such cases. Give our video a like if you believed in them too. In fact, if a person has lost consciousness, you should not lift him up, it will only make the attack worse. What should you do? So is to lift the legs of the victim and undo any tight-fitting clothing. When the person comes to, don't let him get up right away. Also, the victim should not be given coffee or energy drinks. Caffeine will only increase dehydration. Number 8. Treat burns with oil or sour cream. This method is considered effective only because it relieves pain. So why do oil and sour cream help with burns? The fact is that we keep these products in the refrigerator. So when we apply them to the skin, they really do cool down. But herein lies the danger. The butter and sour cream dries the skin and breaks the heat exchange, so the heat doesn't disperse, but goes deeper into the skin, causing more damage. In case of a burn, it is better to hold your hand in cold water for 15 minutes. This will help relieve the pain. Do you know why you get blisters on the burned area? Nothing in our body happens by accident. It turns out that blisters protect the wound from infection. Remember, removing this protective layer can lead to festering. Number 7. Trying to set the bone yourself. Are you a professional trauma surgeon? If not, never try to set someone's dislocated joint. Even though it looks very cool in the movies. In reality, such actions can lead to additional injuries. You can be sued later. The best course of action is to fix the injured limb and see a doctor as soon as possible. Bandage the limb so that it remains in a comfortable position. Immobilize not only the site of the possible fracture, but also the two nearest joints. Number 6. Heat treatment for a sprain. If you have a muscle sprain, a warm compress won't help. On the contrary, it will increase the blood flow, which will lead to even more swelling. In the first days after the injury, cold compresses will help much better. Cold compresses will reduce inflammation and relieve pain. Try to use the injured limb as little as possible, at least for the first 48 hours after the sprain. Number 5. Trying to induce vomiting in case of poisoning. Popular advice says when you are poisoned, make yourself vomit. It sounds logical, but in fact, to resort to this method is not. First, the poison might enter your lungs and damage them. Secondly, if you are poisoned by any chemicals, vomiting doubles the chance of burning your throat. Finally, once vomiting has started, it can be very difficult to stop. The result will be dehydration, which will lead to even worse consequences. The only right thing to do in such a situation is to call an ambulance immediately. Number 4. Saving the drowning. The main thing that prevents us from saving a drowning person is the inability to swim. Even if it does not concern you, you need to remember a few important rules. Try to swim to the drowning person from behind, so he does not see you. Otherwise, panic will make the person cling to his savior. And this can end badly for both of you. Approaching the drowning person, grab his chin or armpits and move toward the shore. Keep the victim's head level with your belly. Number 3. Retrieving objects from wounds. You can pull a splinter out of your finger or a small glass splinter out of your hand, but never try to remove objects from serious wounds. Even doctors don't do this until they get the patient to the operating room. The fact is that the object, while it is inside the wound, stops the bleeding. Therefore, until the medics arrive, it is best not to touch the wound at all. The only thing you can do is to treat it with alcohol. But be prepared, it will be very painful. Yes, it's just a splinter. Of course, a knife sticking out of your leg looks very scary. But even in this case, there is no need to give in to emotions. Just calm down and go to the hospital. Number 2. Putting ice on the bruise. Putting ice on the bruise is really worth it, but many of us do it wrong. You should not press the ice cube directly against the skin. You can get a cold burn that way. Instead, there should be a piece of cloth between the bruise and the ice cube. However, even this option does not eliminate the risk of burns. Therefore, ice should be applied for a maximum of 20 minutes. After that, you should wait 90 minutes and only then repeat the procedure. If you for some reason could not find a tissue, forget about the ice at all. Believe me, a bruise is much better than a cold burn. And one more important point. It only makes sense to apply ice in the first 48 hours after the injury. Number 1. Suturing the wound. Of course, wounds need to be stitched. In most cases, this is the only way to revive. But stitching is a very long and painful procedure. Plus, when the wound is closed, the threads will need to be removed. In some cases, a less harsh option is fine. Skin glue. Such glue sets very quickly and is almost painless. Before applying, rinse the wound with cool water, then apply pressure to stop the bleeding. Bring the edges of the wound closer together, and dab the glue on them. If the wound is too big, however, it's best not to take any chances and go to the hospital for professional help. Give this information a like. If you found this information useful, you may have first aid experience. We look forward to your feedback in the comments section. And don't forget to share the link with your friends. Let them know what to do when someone is in danger too. If this is your first time on our channel, hit subscribe. We've got lots more for you to see.